Okay guys, this is Health Nibble number 98. We're almost to 100. We'll probably keep going. So hopefully we're taking the staff to Vegas for a functional training seminar, and there's some really heavy hitters in the functional medicine world and nutrition world and even fitness world like Ben Greenfield. So hopefully I get a chance to interview all of these brilliant people. But anyway, had a case come across today that I thought was really interesting, and it was this patient. He's had weight loss resistance. He's been a patient for a long time. Typically had upper back pain. Hang on, I'm getting talked to in my ear. It's hard for me to concentrate. So typically it was upper back pain. Today was low back pain, and it's because he lost weight. So we have some combination programs where we do detoxification and weight loss at the same time. So he had some weight loss resistance, and he was in the military, so he was exposed to lots of stuff, heavily vaccinated to all kinds of crazy stuff, so his heavy metal exposure is pretty high. And so he just was struggling to lose weight. So anyway, he does our program, and this guy's a martial artist, and he's active and a coach, and he just completely rocks the program. He loses 30 pounds in 6 weeks. And then he gets back into his, it's an Israeli martial art, I believe, and all of a sudden he has back pain. He doesn't normally have back pain. So it's a pretty interesting case. And so we evaluated his posture. I didn't take new x-rays, but I wanted to show you. Can you see those x-rays? So these are his old x-rays, and he did not need structural correction. So ideally, the green line, to keep it simple, the green lines line up with the red lines, and his line up pretty good, and he didn't have any back pain, so we didn't mess with any spinal correction with that. So as he loses weight, you can imagine his spine has this nice curve in it, but he also has 30 pounds of fat hanging off, so it's actually pulling his low back forward, so it's like a counterweight. Now all of a sudden he's lost that weight, which is an amazing thing from a health standpoint. But he's still losing weight. But his spine, his posture, is he kind of tucks his butt under. So if I can demonstrate it standing up. So his curve is good, and now that his belly is gone, he's like this. And so when he tucks his butt under, it actually flattens the discs out in the spine, and then it loads the discs. So the body's just not used to it. So we need adjustments. He needs adjustments to get the body to adapt and actually change what muscles are strong to adapt to his, to not having all that weight in the front. So I just thought that was an interesting case. You think that losing weight would take all this pressure off the spine and then you wouldn't have any problems, which it does. There's less weight pulling you down, but your body's really smart and it'll adapt. If you get really heavy, it'll adapt and start putting scar tissue and strengthen areas to adapt to that. And then when you take it away, you have to readapt. So just keep that in mind. So that's your health nibble.